We've got very high vaccination rates, and we've got the prospect of being one of the most highly vaccinated countries in the world. However, when you look at the vaccination rates in Denmark for the whole population, it's actually higher than our current vaccination rates, and they stopped everything relying just on vaccination, and they've had a huge resurgence. So, we need to keep some other measures going, particularly the testing and the tracing. Testing needs to be widely available, needs to be cheap, so that, at the moment it's probably, $15 to $20 a test if you want to buy a rapid antigen test. It's got to be really affordable, cheap for businesses and for communities. We need to keep up the contact tracing, need to have digital infrastructure in place to scale up contact tracing if the case numbers get large, and we need to keep using masks in high-risk indoor settings and do the boosters, get the kids vaccinated.
Yeah, well, on boosters, they're just optional at this point, and for the bulk of Australians, they're not 6 months post-second shot anyway. But do you expect them being optional could or should change?
I think there needs to be a campaign to encourage people to get that third dose. In New South Wales, for example, the peak of vaccination probably was around August, which means that the population impact of waning immunity will start to be very apparent by February. So sometime before February, which also coincides with the opening of schools, which will also fuel the spread, it's important that before that time comes that there's a campaign to encourage people to get that third dose, and that we shift our thinking to fully vaccinated means 3 doses, not 2.
And finally, does Australia yet acknowledge the airborne transmission of the virus?
I think in some ways, yes. But we haven't addressed safe indoor air in a systematic way, and that's actually something that would help businesses to be more resilient to COVID. It would help people living in apartments to understand what they can do to mitigate their risks. It would help people dealing with household transmission to mitigate their risks. And I think, we've had the message about washing our hands drilled into us very well, but the awareness about what you can do to reduce the risk of airborne transmission is very low, and we haven't systematically addressed it in schools, for example, or childcare centres or workplaces.
What conditions have led to this fourth wave in Europe?
It's a combination of factors, including the fact that they've been slow and restrictive in introducing the third dose or boosters. For example, in Germany, it was only approved for people 70 and over, and they've just last week or this week changed that to anyone 18 and over because they've had such high numbers. Secondly, it's because the infection is spreading among children who are ineligible yet to be vaccinated, and the European Union has been slow to approve vaccination for the younger kids. So Austria, for example, has gone ahead to vaccinate younger kids despite the EU not having approved it because they're having such a bad epidemic. And the other factor is that the vaccine is that there's been a general abandonment of other measures. Denmark is a good example. In September, they stopped all other measures, so relying only on vaccination, no masks, no distancing, no density limits, no testing and no systematic testing and tracing. You've got to keep those measures up because a vaccine alone is not enough to control the Delta variant, and we've seen it in so many countries play out. So you need your testing, your tracing to be at high levels. In that sense, it's a bit of a concern that Victoria is shifting to ask people to do their own contact tracing, essentially. And you've got to maintain masks in certain high-risk indoor settings and make sure that the booster doses happen in a timely way with high uptake and get the kids vaccinated.